Today, we'll be talking about the biomechanical approach frame of reference. Any change in motor function has a tremendous impact on our ability to engage in meaningful occupations. Now we're going to talk about the remediation. It is focused on motor deficits at client factor and impairment levels using the bottom-up approach. The bottom-up approach is when you start at the bottom or with basics and work your way to the top or improve. Now, what is being addressed here? We are looking at weakness, limitations in range of motion, edema, pain, low endurance, sensory changes, joint instability, poor coordination, and even more. The interdisciplinary base here is anatomy and physiology of the musculoskeletal system, cardiopulmonary systems, and pain reflexes. When looking at populations, anybody with a physical impairment can benefit from this approach. Now, what causes these physical impairments? Joint damage, swelling around the joints, pain, skin tightness, or muscle tendon shortening, just to name a few. Also have muscle spasticity. And for our second point here, muscle weakness due to disuse or disease. And third of all, extended confinement or limitation of activity. Here we have the pathology of cardiovascular respiratory systems can also reduce the endurance we are looking at here. This approach assumes impairment can be remediated, and that remediation pretty much means that there's improved occupational performance. That being said, looking at function and dysfunction, it's pretty much problems that occur when the person can't generate or sustain stability or movement needed to perform their occupations. And looking at this OT philosophy here, we are occupation-based, and we are asking how does this align or not align with the biomechanical approach based on what we are doing. So how do we assess these things? We look at range of motion using a goniometer, strength, manual muscle testing, instruments, and endurance. So with our strength here, we're looking at the maximum tension produced under voluntary effort. Muscle testing is testing that ability to produce resistance. Instruments like a dynamometer for hand strength, and endurance looking at the intensity, frequency, and duration measured by determining the number of reps before fatigue. Now, next we have our intervention. So focusing on improved motion, strength, and endurance, but also underlying causes. Why do we do this? This is a way that we can determine the most appropriate intervention for our clients. For example, tightness would be stretching, swelling, use compression, or massage. Another intervention is orthosis and prosthesis. Splint support, immobilizing, or positioning joints. This is used to correct deformities and increase function and can be temporary or permanent. It really just depends client to client here. And last, we have our physical agent modalities, or PAM, passive manipulation and exercise. This is used when necessary to develop or support the ability to engage in our occupations. Now we have our factors of change. First of all, we have maintenance and prevention and restoration. Use it or lose it is what's happening with the maintenance and prevention. Muscles are able to produce contractions and move the joints and should be able to maintain capacity of functional motion, joint positioning to prevent deformities, and looking at the biomechanical problems and figuring out that this is by how people perform the task. Restoration is our aim to increase available motion, strength, and endurance. Movement in tasks maintain or improve normal range, strength, and endurance. And goals are based on potential of the person and movement demands of the occupation. And that is our brief overview.